Hey, this is Ashish. I'm a junior doctor in the UK. Today's video will talk about clinical audits. Now, clinical audits is one of the topics which IMGs are not usually familiar with because we don't usually do clinical audits in our countries. So I'll try to answer most of your questions which I have received on my blog and on my Instagram page. So first of all, what is a clinical audit? So a clinical audit is a systematic review in which you try to compare your current hospital practices with the existing guidelines. This ensures that we are able to give the best healthcare services to our patients. When these standards are not achieved, we try to improve on our practices according to the guidelines or the standards. Audit cycle comprises of the following steps. The first step is to identify a problem. Now, these are all the clinical practices where improvements can be brought about in the system. For example, you can check whether the surgeons are filling the post-operative proforma in the hospital properly or not. The second step is to find the standards for the existing problems. Now, these are the standards which are set up by NICE, Royal Colleges, or the existing societies, and these are the standards against which we'll be comparing our current practices. For example, the Royal College of Surgeons has guidelines on how to fill the surgical post-operative proformas. The third step is data collection. This involves looking at the data to identify the problems in the current practices. This can include looking into patient notes and records. For example, you can start collecting data looking at the post-operative surgical proformas in your hospital for the past 1 month. The fourth step is to compare your current practices with the standards. So you'll have to start with summarizing and analyzing your data, and then you will compare all of your results with the existing standards. For example, you'll compare the data which you have collected from the post-operative surgical proformas with the guidelines which are set up by the Royal College of Surgeons. Step 5 is to implement the change. This step will include training the staff, improving your documentation, teaching the staff, conducting various training sessions. For example, in our hypothetical audit, we can start by organizing teaching sessions for the surgeons. We can also print out all these guidelines by Royal College of Surgeons and put it around in the theatre area. The sixth step is the reassessment of your implemented changes. This will include repeating step 3 and step 4. So if the standards are matched after the re-auditing, you'll ensure that the staff is continuing the best practices. But if the standards are not met, you'll have to repeat step 5 and step 6 again. That is, you'll have to implement more changes and then you'll have to re-audit again. So one of the questions is how you should begin a clinical audit. First step is to discuss your ideas with your clinical supervisor or educational supervisor. Now, in the home countries, this can be any professor or assistant professor who can assist you with your audit. You can discuss your ideas with your colleagues as well, and they might help you in conducting this audit as a team. In the UK hospital, there is a separate department for conducting audits. So after discussing your ideas with your colleagues and clinical and educational supervisor, you can go to the audit section and they'll help you on deciding how to conduct this audit and how to bring about the changes. Audits take a lot of time to complete, so you should plan them so that they are completed and presented well before your training applications start. My second tip is to collaborate with your colleagues so you can do multiple audits at a time. So they can start doing the first cycle of an audit and then you can complete the second cycle of the audit. And for the next audit, you can do the first cycle and then they can do the second cycle. Always try to audit in the specialty which you are interested in applying in. This will show that you're committed to that specialty because you're bringing about positive change in the specialty practices. Always try to present all of these audits which you have done in local, regional, national or international meetings. This will give you more points in your training application. Whenever you go for any of your interviews, always learn all the facts and figures about your audits because these are tested during your interviews. It's always a good idea to close the loops, which is doing the re-auditing step as well, because that will score you higher during your training applications. In case you're not able to close the audit loop, don't be discouraged. Always put these audits in your training application portfolio because they will give you some of the points. One of the common questions is, what happens if you're not able to show positive changes in the system after you have done your re-auditing? It won't be a waste of time because you have still completed the audit cycles. This just means that you'll have to implement further changes to bring about a positive result, followed by re-auditing. Thanks for watching this video. If you liked the video, please like, share and subscribe.